Hello and welcome to Goodie Wellness. I'm Alexandria and today I am joined by Dr. Tamika Henry. I am so excited that you're on today. Thank you for coming.
Oh my gosh, thanks so much, Alexandria, for having me. I'm so excited to be here on Goodie Wellness. I love what it represents and what you are doing to get the message out to the masses.
Yeah. We're going to try to reach the masses, starting small, getting big. But I just want to first talk about your experience in functional medicine, how you got into it. Can you tell us a little bit about your backstory as a doctor?
Oh, well, I am, as you know, a board certified family medicine physician. So I was trained under the traditional setting. And what I realized in my training is that I was doing a lot of geriatric medicine. So I was taking care of the sickest of the sick, going into nursing homes. And I was seeing people with the same problem coming in and out of the nursing home. And I'm like, there has to be a better way. So as this journey proceeded, I was like, I need to look into other things. And some people were overweight. Some people were coming in with hip fractures. And so I started, because I'm in California, I was like, everybody's dealing with weight. So let's go ahead and let's deal with looking into weight management, so obesity medicine. So I went and studied about that. And then I was like, well, people lose 5 pounds, they gain 2 pounds. So like, no, this is not it. So then I started learning about bioidentical hormones. And I was like, okay, this must be it. Bioidentical hormones are where it's at. I'll figure out what's going on with people's hormones. I'll fix that. And voila, that'll be it. Then I stumbled on functional medicine. I'm like, okay, this time, Mom, Dad, I got it. It truly is functional medicine. That's to say, I was already board certified family medicine, but it was like I was searching for something to really have an impact, to really help people make a difference in their lives. And functional medicine looks at like, what's the root cause? Like, why do you have this in the first place? And I was like, this is my jam. This is my spot. So I went and I learned, I did all the courses, I took the certification exam, and I was like, and then I started getting clients. And they started getting better. Like, oh my gosh, it's working. It's really working, right? And that's to say, many people look at functional medicine like, oh, it must be some hocus pocus, but there's a lot of science, there's a lot of articles behind it. And then I just started my practice and started working with people and just having a good time at it and being able to really listen and understand like, okay, what are you dealing with? And let's see how we can figure this out together.
Yeah, I'll talk about how I met you. I was coming out of a season of a lot of stress, mid 2019, and I didn't have any diagnosable issues, but I knew I didn't feel good. I knew I felt off. So I was going to my PCP, going to a neurologist, dermatologist, a chiropractor. I was like at everyone's office, spending a lot of money. And there wasn't anything specifically wrong that they could be like, this is your issue. So they would give me a pill for inflammation or whatever, pain management. But I knew that that was just a Band-Aid. So I started my search to see like what else could be going on here. What's that the cellular level that is happening with my body so that if I don't have any diagnosable issues, I don't want to get to a point where I do have hypothyroidism, Graves. I didn't want to get to a point where I had something like truly. So I said, okay, if I'm at this kind of cusp area, let me see what's going on so I can try to prevent that. And I came to you, guns a-blazing.
Oh, you were like, woo, I remember.
Energy. I had all this research, we were going toe to toe. I was like,
I remember like, okay, what about this? And when I read this, but that's what I attract though. I attract people who are trying to gain knowledge, right? They are true health seekers and they are trying to be as proactive as they possibly can be with their health. And I think a lot of people, it's like, it's not that they want to be unhealthy. I mean, that's why we have supplements everywhere. Like you can go to Walgreens, Walmart, Sprouts, Whole Foods and grab a supplement because people are trying, they've been online, they've been on Instagram, Facebook, trying to find an answer. And it's like, they practice what I call the HAP method. And they're like, what's the HAP method? I'm hoping and I'm praying I get it right. So, right?
Real on my.
That's like, please let this, like, is this going to work? And I think people try and then you read this and there's not a shortage of information, right? There's not. The question is like, what applies to you and how do you personalize it? So that's when I get clients like you, Alexandria. It's fun because you're like, look, I have this based on this right here. this, and this could be the issue, right?
And I knew that I wanted to, of course, have a doctor that prioritizes preventative care and making sure that we are looking at the actual root cause of things, because I wasn't coming up with anything. So it's like there has to be something in the blood work that I can figure out and just feel well again. So can you talk about what an experience, well, I guess actually if you can differentiate between like a PCP, a primary care physician, and conventional medicine and functional medicine, and then like what is the experience with you?
So that's a great question. So what I tell my clients is that I'm an adjunct to your primary care doctor, right? So I'm there to help facilitate making sure as a team, I truly believe the best care to give someone is when you have a team working for your best interest, right? So you have your primary care doctor who's doing the basics, doing your physical, maybe dealing with some urinary tract infections, some colds, or things of that nature. But what I'm bringing to the table is I'm just looking at it from a different perspective, partially because I have more time. I have the time to sit and like actually listen to what's going on. My first visit is approximately like close to 90 minutes. And I always say it's anywhere from an hour to an hour and a half because it depends on how much we chit chat, but all my clients talk, every one of them. I don't have, none of them are like, I'm done, that's it. But when we first start, right? Yes, you and so many more. When I start with someone, it's important that we look at it from like what's going on completely. You just don't want to focus in on like, oh, I'm having skin issues or my hair is coming out or I'm tired. You want to look at the whole person. And I think with traditional medicine, we just don't have that time to do all of that, right? And I don't discredit it whatsoever. I am board certified, trained. I will back traditional medicine 100%. What I'm saying is that people are searching for more and they're just not looking for a pill for every ill or like it's all in your head. I think a lot of people want to be validated by, there's something going on. But when they look at it from a traditional state of mind, it's like the labs look great, but you're like, I feel awful. But I don't care what that lab says. I feel awful. So there has to be something that's behind that person feeling that way. Like, oh, let's just give you a pill for antidepressant or something for this. But people aren't searching for that pill. They're searching for, well, why do I feel this way? And when I have people who are looking at it from like, I want to know what's wrong, right? That's what they're looking for. They want to know, what is it?
Yeah.
And so when you try to look at it from a functional medicine point of view, when I work with someone, I'm saying, okay, let's start with the basics. And the basics are we want to do comprehensive labs. And then it's like, oh, but I've had my labs drawn before. I've had that, Dr. Henry. Like, you may have had it, but you haven't had it like this. We're looking at inflammatory markers. We're looking at hormones. We're looking at a very comprehensive thyroid panel. And definitely we look at some basic things. But then at the end, you get this 18 to 22 page report where we're going to break it down from like, here's the functional medicine range and here's your traditional range. Traditional range of labs may be a little bit wider, so it takes a longer time to pick up on something. And what I mean by that is you may feel, well, I'm doing well and the labs are normal. Then the question is, okay, you look at the functional medicine range, that may be more narrow. So it may pick up on things much sooner. And so now you're looking at like, okay, I don't necessarily have disease as you described earlier. I don't want hypo or hypothyroidism, but maybe there's some signs of like, it's not optimized. It's not functioning the best that it possibly can. Maybe my hormones aren't balanced as best as they can, or I have a lot of inflammation, and inflammation is the root of all evil, right? And when I talk about inflammation, for those of you who are tuning in here to Goodie Wellness, shout out to you, Alexandria, for this. Inflammation, that's basically your body is like, you know what, we got to fight against this. So if we describe inflammation, we have internal and external inflammation. External, and I use this example, if we were to scratch the back of our hand, eventually we scratch and scratch and scratch. Eventually, this will turn a little red, it'll get a little swollen, and eventually the skin will break down and it will bleed and it will continue. That we can see. External, yes, we get that. Internal, brain fog, gaining weight, headaches, joint pain, not feeling right. You can't quantify, you can't necessarily see it, but it's actually going on. So when we're looking at this comprehensive blood work, I want to know about inflammation because many people have a lot of inflammatory processes going on. So that's why I like how I approach functional medicine and combine the both worlds of functional and traditional medicine.
Something I really appreciated about you is because I did my research and I looked at other doctors, but you said, I don't even want like to have we don't need to go through 3 or 4 sessions together without your blood work. Like I want this so I can actually support you based on the data. And that's really important when you're looking for a functional medicine doctor, someone that's going to prioritize what is actually happening in your body based on the blood work and not just like, well, based on our conversation, let me try this out for 2 months first, and then we'll get to the blood work. because that was super informational for me. And it's something I was able to take that information, and it was an interesting experience going to Quest and going to get my blood drawn. And they're like, you're getting all this blood
Yeah.
dying tomorrow? Like,
oh my God.
you were like, look, they're going to look at you side-eyed because you're
Yeah.
piles of blood drawn. Because it's normal, but it's so interesting because it's not normal for you to look at how to optimize your wellness. It seems like, and please correct me if I'm wrong, in traditional medicine, it's keeping you from disease instead of optimizing your health, which I feel like functional does.
I definitely we're focusing on optimizing the health, your health in particular. What I want you to realize is that insurance only lets you do so much. So I think a lot of doctors' hands are tied because you have to have a diagnosis to get this test, to get that. And I don't want my hands tied when it comes to me trying to help you to be the best that you can be. So that's why I'll say, we're going to do something a little different. We're going to step outside of insurance and we're going to get this blood work. Hang with me here. Get the blood work. They're going to look at you like you're crazy. And I try to warn everybody. I'm like they're going to be like, really, all this? And
Yeah.
you just respond with, I'm just trying to look out and do the best for me. So I'm going to get this. And you get it. And the blood work, like you've already stated, does not lie. It doesn't lie. It can't lie. It can't, unless they put somebody else's blood and gave your name on somebody else's results. No.
Really see what's going on, and it was just super helpful for me. What would you, because it's an interesting point, you talk about going outside of insurance. So something that once people look into functional medicine, and I do hope they start looking into it, there is a cost difference than going through an insurer. So what are some of the things that you come up with clients, and how do you help people navigate some of the, cost barriers possibly?
Oh, you just led me right into like the perfect, Alexandra, you do. I'm like, look. So it's interesting because in functional medicine, there is a lot of people, a lot of providers like myself who are not able to take insurance because it just doesn't allow us to do what we need to do, right? So it's like, okay, I need to get all this done. And then you had to make sure that people are getting results. So what I've done is definitely you can work one-on-one. We have different programs, right? Work one-on-one. We do either a 3-month or a 6-month. But recently I started this online group because I was like, you know what? I have to be able to reach more people in a way that's cost effective, but in another way that's like, community. Community is, especially during the pandemic, we need more community now than ever before. I mean, the social distancing, physical distancing, the mask, do I cover my face? Do I wear gloves? Do I look at you when I cough? I mean, it's real. So this online group, and actually it takes off like next Tuesday, the day after Memorial Day, because I wanted to start with a foundational group that's like, okay, let me do functional medicine in the group setting, because one-on-one I can do a lot because it's you with me, but that's rate limiting. I can't have such a large impact and help you impact the people around you. But if I teach in a group and then the group helps each other and then we can help the people around them, then it spreads. Then now everybody has a little bit, because a lot of communities may not know about functional medicine or may not be aware that there's an alternative that they can be doing besides taking a pill for every ill, or wondering like, well, my doctor said do just this. I tell people every day, I am not your guru. If the buck doesn't stop with me, this is a partnership. What will you do? If I tell you, okay, if I tell you you can't eat bread and that's your make or break, like, oh, she said I can't have bread, I can't talk to her. That's a problem. So like, I got to meet you where you are. Right? It's like, not, oh no. Or like if I say you can't have wine, red wine, do you not know red wine is healthy? And I'm like, no, it's just a matter of red wine is healthy, but you have to be nearly drunk to truly get the benefits of it. So let's meet you where you are. And I think a lot of times in community and even in practices like mine, you're able to meet people where they are. And that's important. That's a partnership. That's not a guru. That's not me telling you, or you like, I want to do this, 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 and this. Like, oh no, together.
Yeah, that's good. Okay, so there's a group coming, more cost effective, also able to do it with, pandemic at hand. Kind of.
Yeah, that's what I love. And it came up with this name, Rock Your Body from the Inside Out. And functional medicine is about working on the inside and then it manifesting more so on the outside, right? So that's the name of my group. And I love that name.
So this specifically, I really want Goodie Wellness to be geared towards minority groups, disenfranchised communities, people of color. what are some things or just some words that you would have for, Black and brown people that are disproportionately affected by COVID, by most diseases? Like, how can we start to get to wellness? What are some thoughts around that?
So first and foremost, I don't want those of you who look like me, sound like me, or can relate to me to think that, it's in my genes, so I'm just stuck. So what my mom had it, my grandmother had it, her grandmother had it, my great. I think we need to come out of that mindset. And the reason why I say that is genes load the gun. It doesn't pull the trigger. It's what else is going on around us that's impacting us. What are we eating? Who are we hanging out with? How much sleep are we getting? What's going on internally? Like, how are we dealing with stress? I mean, that all that plays a role. So I would say for right now, don't go down a woe is me. This is what it is. It is what it is. No, it's not. You have a choice. You can choose what you do with your body right now. And you can start today. Like, even if you have diabetes, high blood pressure, congestive heart failure, high cholesterol, a family history of cancer, or you're just like, I'm just off. My body, haven't done anything for years. You can start right now today with working on your health. It could be as simple as changing your mindset. Number one, like, I'm choosing not to be in this position anymore. So what steps am I going to make, right? So number one is choice. I got to get my mind. I tell people, get your mind right or get ready for it, right? Get ready for it. The next thing I would definitely push was what's easy stuff. So you got to get easy wins. You have to meet people where they are. Another easy win is water.
Yeah.
It's simple. It's so simple, and yet people still don't do it. Oh, I drink enough water. How much should I drink? There's some schools of thought that you should drink half your body weight. My thinking is this: if you're drinking nothing and you go to 2 bottles, that is a win. That's a huge, huge win, right? So if we're thinking of how much, you want to drink until your water is clear. Your urine is clear like water. So we're at home anyway. So if you're peeing nonstop, it's okay. You're just going to the bathroom at your house, right? So we have that. And another thing that's easy. And it may be a little bit more of a challenge because we are home, getting enough rest.
Right. Yeah. True rest. Okay.
True. And the rest is not, I have my phone.
Exactly. I have that issue. I'd be like, why is it 20 minutes before I plan to sleep and I'm on my cell phone? I can't do that.
Right. And then with all the stuff going on with the pandemic, people are like, they're so caught up in like, what's next? Are we open? Are we not open? Is the hair salon open? Is the nail shop open? It's like, why is that state open? Why is that county open? I mean, let it go. You can't look at it all day. And simple wins right now. I mean, like right now, I would say, even when we think about supplements are at an all-time high. People are buying them off the shelf because they're really trying to be proactive with their health. I would say as simple as if you had some vitamin C on board. Vitamin C, at least 1,500 to 3,000 milligrams is great. Vitamin D as in dog. Let me just point this out. Even if you have color on your skin and you're darker, just standing outside does not mean your vitamin D level is good. Yeah. No. I have to point that out. Right?
In fact, we usually have the lowest vitamin D numbers. Yeah.
We have low numbers. I had a meter maid and a construction worker who were my clients. And they're like, my vitamin D levels, I'm outside all day. It's great. It was like tanked, 17, 20. I like numbers 50 to 70. I like them higher because vitamin D helps fight against cancer. It helps fight against inflammation. These are things that we can do. And I'm not a big pill pusher, right? I don't want you taking a whole bunch of pills. I want you definitely to get the right foods in your body, decreasing processed foods, really starting with like, if it's in a box and it has like 50 million ingredients, you probably should be eating it.
Right. Yeah.
Right. I mean,
it's interesting because I love what you said first about changing your mindset, because people know the basics of what they need to do, but for some reason, there's just a barrier in mind. I was talking to a close family member the other day who has a degree in health education, and they just were like, I just don't want to do right. It's just, and so it's an interesting thing. It's just, it really does take commitment to shifting your mindset. And the more information you have has helped me, at least, to be able to shift it. Because if you're ignorant about something, there's an easier way to have an excuse to like not act on it. But the more information, then you can say, I'm empowered. I know this now. I have control in some ways. So I appreciate you because you helped me become empowered with my own health.
Like
So
you can, I just add a little oomph. You were already like, let me do, here's this. What about this? Now, this is what's going on in my body. So what you think about this? I mean, and not everybody comes to me that way, but I do get a lot of people that way. And what I mean by that way, I mean just really trying to search for a way to just become their best self and get the best health as possible. But it's just a matter of you have to own it, right? And recognize you're going to hit some bumps in the road. Sometimes you're going to be right clean and everything. Like, I'm eating clean, I'm working out, I'm journaling, I'm doing all the right things. And then you fall off the bandwagon. Push pause. That's called life.
yeah, yeah. up about anything. That's
right.
Like have patience and grace with myself, because that also messes with your what is it immunity. If you're
right.
like down on yourself, that also helps, or hurts you rather.
Right. So if you're thinking about all this stress, when you're beating yourself up, that's an internal stress that you're really like impacting your body. So if you're chronically stressed, that leads to increased risk of gaining weight, being tired, your immune system gets compromised. And you'll know people who are under a lot of stress, sometimes they'll manifest as like, that's that person when we were all at work in the building, constantly sick. Like no matter what, they're constantly sick. Like they walk into the room and you turn the other direction because you're like, wow, she's sick again. Oh, he's sick again. That's the body's like, it's just taxed, it's tired. And so now we're like, what do we do? Now we're home. What can we do to start to truly boost our immune systems? Vitamin C, vitamin D, zinc. And that's even helped with the coronavirus. I mean, even they've shown that now there's different ways they're showing that it's decreasing the viral load or helping you decrease replication, but it's helping your immune system. So what do we do? Curcumin, many people are familiar with turmeric. That helps boost the immune system. And that's like I call that like a double fold. Like if I can use it for two things, that helps boost the immune system and it helps fight against inflammation. Oh, now we're talking. We're doing different things at once, right? With one simple supplement, whether that's a liquid or a powder or a pill. And I'm not trying to change like a prescription pill for a supplement, because you've got to do the basics. You got to eat right. You have to get your rest. You have to have the right attitude. You got to make sure you're getting your water on board. Oh, movement. Everybody's stuck at home. I have people exercising less now, right? I'm like, you're at home. Oh, I know. Exercise is a bad word. Okay, move. Just get up and move, right?
Yeah, keep it easy. I told my mom, I was like, just turn on 3 songs that you really love and just dance to those 3 songs. Because if you do that, that's enough movement, easy. Let's start.
Easy. Because people need easy things that they can do right now. That's like, and it can't hurt. Like, I don't want to hurt. I don't want it to ache. So easy dancing or a simple walk, walking down the street, even if it's as simple as 3 minutes up, 3 minutes back. It's some type of movement. One of the things I point some of my clients to, and I'm opening it up, all of those who are tuning in, that 7-minute workout. Just Google 7-minute workout. You have 7 minutes.
Absolutely.
7 minutes. That's simple to do that.
I want to touch quickly on coronavirus since it's such like on the zeitgeist. Do you have any specific information towards that, or does the rest of what you said kind of apply to it?
I believe we're at a point right now that I think they're really trying to understand more so like, do we test? We don't have enough test kits as it is, right? So one thought is like, my husband's in the nursing home industry and they tested every single employee and every single patient, and they still don't have all the results back. And then there's this idea of you may get tested and it's negative, but eventually you may be positive because it tested in a window where it came back negative. So that doesn't mean, what I want people to understand, even though we're slowly opening up things, that doesn't mean no mask, don't take the same social distancing precautions. People are like frustrated, like, I'm done. I don't care. I'm doing this. I'm going out. Let me just get sick. Like, no, Texas just had a big rise in deaths the other day. So, and they're open. So we got to learn. In California, we're densely populated. New York, densely populated. When we're thinking about coronavirus, we still have to do the basics. We have to recognize that when we're looking at the testing that's out there, there's still like, is there going to be a vaccine? When will that be ready? It's going to take some time. Will that be the answer? I don't know, right?
I'm a little woo. I'm like, I don't know about a vaccine, okay? Right. I don't know about this.
Me either. And I say that wholeheartedly. I just like, we still have to do the basics. We still have to understand that we don't have all the answers. Will the kids go back to school? shout out to all the people who graduated in 2020, because you're not having the normal graduation. You put all the time and energy and effort in, but we don't even know what the school is going to look like in the future. Will it be virtual? What do you do with the elementary kids? I think we still have so much ambiguity, but yet we know that we have to do our part to take care of ourselves at the end of the day, right?
And I think, there's so many questions that just focusing on what you can control seems
Yes.
something to reduce the stress,
Yes, that would be my tip for the day, regardless of are we doing this? Are we doing that? You know what you can control. You can control your health right now, today, no matter where you are. You can control that. And I believe for me personally, what I tell people is where that begins at is the mind. So unlimited thinking, unlimited you. Take the limits off.
Absolutely.
Truly take the limits off.
Yeah. I think that's a great place to stop. I want to talk about how people can find you if they want to schedule a consultation with you. Tell us everything.
Okay, so I know people are really big. This is the social media town. Like, everybody is on social media. One of the big things on Instagram, I am at I am Dr. Dr. Tamika, and we spell Tamika all kinds of ways, so I'm going to spell it out. Tam as in Mary, Ika. So I am Dr. Tamika. You can hit me a message on there, and if you want to reach out to me there. Also, you can go to my website, which is Unlimited Health Institute. I know it's long, but it's easy. And you can just do a schedule, which is a free 15-minute unlimited health and wellness call. It's literally a call, no cost to you. Majority of the time, I would say 90% of the time, you get me. So we'll talk and see where you are and see what the next best step for you is. But those are the best ways to reach me. So on my website, and I also have a Facebook group. That's a private Facebook group that I literally offer different tips inside of. And that is The Art of Living an Unlimited Life. And that's a private, I'm all about unlimited, as you can see. I need to take the limits off, and I try to practice what I preach. But definitely Instagram, I am Dr. Tamika, or Unlimited Health Institute, or my private Facebook group. Either one of those methods are great. But always, I got to give you a shout out, Alexandria. Keep making this happen. Keep it real. Make the guests keep coming. Keep us talking. And let the people know that there are alternatives out there. There are options out there, and they can too be healthy.
Yes, thank you. You're amazing. Oh my gosh. Thank you for your time and for your knowledge and wisdom. So, take care, everyone. See you next time. Bye.
Bye.